Hi, I'm Jamie DeRollo, and I'm the head athletic trainer at Modesto Junior College. I'm also a DAT student at Temple University, and this is my workshop final project for therapeutic rehabilitation techniques in sports-related injuries. Thank you for choosing this workshop, and today we're going to discuss to cup or not to cup. Is cupping right for your patient? After reviewing this video, you should be able to describe the different cupping techniques and their applications. You will be able to apply suction cupping to various parts of the body for treatment and rehabilitation purposes. And you will be able to also demonstrate cupping techniques with proper application and removal of cups. For a brief overview of what we're going to be going over in today's video is the clinical importance of cupping, the physiological effects that it has on your patient, the indications and contraindications as far as when you should use cupping or maybe when it's not such a great idea, identifying the different cupping techniques, and then reviewing some of the current literature and studies that are out there. I just want to note that in the past, most of the studies have been done in Chinese, and it hasn't been until recently that there have been more research and studies out there in English. So we're a little bit limited in that aspect. And then finally, we'll be talking about how you can incorporate cupping into your practice. At the very end of this, we'll be doing more of a lab type situation and scenario where we're able to actually get our hands dirty and apply cupping to several different parts of the body. Cupping therapy. It may be trendy now, but it's not necessarily new. It dates back to ancient Egyptian, Chinese, and Middle Eastern cultures. One of the oldest medicinal textbooks in the world describes how the ancient Egyptians used cupping therapy in 1550 BC. Cupping therapy is a form of alternative medicine in which local suction is created on the skin. Cupping therapy is an ancient form in which therapists put special cups on your skin for a few minutes to create suction. An air pump can be used to create suction, or materials like alcohol that can be either rubbed on the bottom of a cup, or a cotton swab that is soaked in alcohol is placed in a cup. The materials are then ignited, and as the fire goes out, the cup is carefully placed upside down on specific parts of the body. The cooling air inside the cup creates a vacuum and provides an adequate amount of suction that causes blood vessels directly below the skin to dilate. The therapy cup is typically left in place anywhere from 5 to 10 minutes at a time, and the therapist may choose to use several cups at different points or several different meridians at the same time. Patients receiving cupping therapy can rest assured that there is rarely any burning of the skin. It's going to feel a little bit of warmth, but you won't feel the actual fire for the fire cupping. There are several different materials that can and are used for cupping, such as bamboo, glass, earthenware, and silicone. Earthenware is something that I wasn't necessarily familiar with, and it's a pottery that has not been fired to the point of vitrification and is slightly porous and coarser than stoneware and porcelain. Back in ancient times, there were actually horns that were used, different animal horns that were hollowed out that were used for cupping. People do cupping for different reasons. Some of it will include to help with pain, inflammation, blood flow, relaxation, and well-being. Some will even use it as a type of deep tissue massage. There are two main types of cupping. One is dry cupping and the other is wet cupping. This video we're specifically going to be going over dry cupping. Dry cupping is a method in which suction is created in particular points on the patient's body. Suction can be created using either heat to warm the cups so that the cooling air inside creates a vacuum and tugs the skin upwards, or using an air pump or a mechanical pump to actually siphon the air out of the cup. In today's times, glass cups are more often used so that the therapist can monitor the condition of the skin. But there are medicinal grade silicone cups that are also used because of their pliability and the ability to be able to use it over and over again. Wet cupping, which is something that I do not even want to touch base with or, delve into that realm, is basically a technique of dry cupping, but it takes it a step further. After you apply a dry cupping for about 3 to 5 minutes, the therapist or the clinician would take the cup off and put tiny cuts on the raised area to help allow for the elimination of toxic blood and fluids. The cuts or pricks could be performed with 3-pronged needles, like in the case of Chinese cupping therapy, or with lancets or scalpels. So then another cup is placed on the same exact area to suck the blood up. The clinician in that aspect could potentially apply pressure around the treated area to speed up the flow of blood, but once the cup is removed, you have blood and biohazard and all kinds of other issues that you could potentially be dealing with. And then the lances, or where the cuts in the skin you would treat it with antiseptic ointments and bandages to help assist in the healing process. So, like I said, for the case of this recording or this video, we're going to be focusing particularly on dry cupping. And we can actually, with dry cupping, you can do a portion of it as far as moving cupping, where it's very, very similar, and you'll move the actual cups around. Okay. The physiological effects of cupping is when dry cupping has an effect of redness in the skin and some amount of swelling. Blood and fluids accumulate under the skin. This therapy does not cause any pain, and at the most, the patient might experience a pinching sensation followed by relaxed feelings. There has been times where blisters, or for lack of better word, hickeys or bruises that form, some of the patients would call them cupping bruises or cupping hickeys, that would have, leave a mark on your patient. Some interesting effects is that it can increase the number of fibroblasts and collagen, and it can alter the fibroblasts and the collagen orientation. There are several studies, which we'll get into shortly, where it talks about a decrease in pain, and there were a couple of studies that talked about a decrease in itching, or there's other reasons or instances in which you may use cupping, and we'll get into that. Okay, so with cupping and the cupping treatment, there are different things that you can do. For helping with pain management and healing process associated with the following disorders, such as different orthopedic conditions, fibromyalgia, neuromuscular disorders, asthma, arthritis, and even depression. But it should only be used by those that are knowledgeable in actual cupping techniques. For the pre-treatment administration, you should be doing, for the case of this, we're going to be doing dry cupping. You're going to apply lotion or oil on the skin, especially if we're going to be doing it in combination with the gliding or the movement cupping as a form of massage therapy. Post-treatment, when it's performed, you want to make sure that you advise the patient to hydrate. And also, once the cups are removed, you want to perform some type of massaging area, and that will help reduce the appearance of redness and swelling, and even sometimes eliminate the bruises that appear on the skin. The redness usually settles within a few days, but when it's combined with several things or left on for a long duration of time, it might leave those bruises or hickeys. And then you're able, with cupping, you can do different treatment combinations. Dry cupping can be combined with other forms of treatment, such as massage therapy, gliding cupping, magnetic cupping, and other things. For wet cupping, it should only be performed by itself. You don't want to be moving the cup around while there's blood in there. Okay, for the indications and contraindications, although this is a non-invasive form of treatment, Chinese cupping is not recommended for pregnant or menstruating women. Patients that have bone fractures or muscle spasms also cannot be given treatments. In the case of patients that have a form of cancer that is spreading from one body part to the other, cupping is not advised. And if a patient is suffering from a particular type of condition in which he or she bleeds easily or potentially has a high fever, the clinician should refrain from using cupping as a treatment. And then there's also certain areas of the body where cupping should not be used, such as over an artery or an ulcer or any part where there's evidence of deep vein thrombosis. Since cupping treatments are usually performed on soft tissues, such as the fleshy parts of the body, clinicians should not provide treatment to very thin patients, is what some of the research is saying. Patients do not usually experience any serious side effects due to the cup therapy, except for potentially some minor discomfort, the circular bruises or hickeys, potentially swelling, or slight warmth in the area. These effects are generally not painful and usually disappear within a few days and leave no lasting impressions. If you were to do the wet cupping, you open the patient up to being able to have some type of infection or skin issue that can and does arise. The other reason why you may not use cupping would be if they have any type of hemorrhagic diseases or hemophilia, leukemia, or if they're having any type of skin issue or irritation or infection on the skin. You don't want to use cupping over that area. And with this, I want to show you a couple of videos of different techniques. At the end of this, we're going to do more of the hands-on or lab time, but I want to show you some techniques that I will not be able to show you, such as the wet cupping or the flash cupping. Okay, and on here, this is a video of after they've already cupped and then they've lanced the skin and applied the cups on there again. And as you can see, blood is perfusing through the skin. If you wanted, you could potentially apply pressure on the cups and make the blood come up quicker. But again, this is something that I'm going to advise or deal with. You also want to check with your state licensure act and make sure that you're covered legal-wise as far as dealing with any of this. Okay, and this is a great example of flash cupping. I personally will not be putting fire or having fire anywhere around my athletes or in my clinic, but this is a viable option for those that are comfortable and proficient at doing this. And here is a great example of moving cupping. This is using fire for the side. He has lotion on the skin and he's able to move it around. You're still able, even if you don't use fire, you're using it for suction, you're still able to do movement cupping, and we'll go over this shortly in the lab portion of this video. And on to current studies. There's a report that was published in the 2015 Journal of Traditional and Complementary Medicine that notes that it could help with acne, herpes, and pain management, which is very, very similar to the findings in the 2012 PLIOS 1 published article in which Australian and Chinese researchers reviewed 135 studies on cupping. They ended up concluding that it is effective with people and also other treatments like acupuncture or medications for various diseases and conditions. While blinding during studies on cupping therapy is very difficult to achieve, at the very least, blinding of the outcome assessors and statistics should be attempted to minimize performance and assessment biases. In the study Hujan and Among, they included trials where 57% used wet cupping as the main intervention, and of that, 17% used retained cupping, while 9% used moving cupping in the trials, where they used flash cupping as medicinal cupping and use of needle cupping, and all of which found that it alleviated pain for low back pain. Okay, there was a meta-analysis that I reviewed that cupping therapy combined with other treatments like acupuncture or medications are going to show significant benefit over specific treatments alone in affecting cure for acne, facial paralysis, and cervical spondylosis. There's also a study that talks about where it was causing vasodilation and stimulating the blood circulation, that they found it did in fact increase metabolism and accelerated the elimination of waste and toxins from the body. And then in another study, they concluded in a systematic review that traditional Chinese medicine for cupping was used to effectively treat neck pain and low back pain. With that, it was suggested that cupping may be more effective than medications for the treatment of chronic neck and low back pain. And then the study Kim found that with at least 6 sessions of cupping therapy, both wet and or dry, on the neck pain with acupuncture points in the 40 patients that they studied, it was more effective than just the use of a heating pad. And then the other study, it proved that there was effectiveness of dry cupping therapy on the pain and function of patients with plantar fasciitis compared to just electrical stimulation therapy alone. With this, it's the first study that's done on the effectiveness of dry cupping therapy on the pain and function of patients with plantar fasciitis compared to electrical stimulation therapy. And a recent systematical review on traditional Chinese medicine identified that cupping therapy, along with acupuncture and acupressure, could be as effective in treating pain and disability in patients with chronic neck pain or chronic low back pain. It's also been used in treating different painful disorders such as low back pain, neck and shoulder pain, fibromyalgia, knee osteoarthritis, and carpal tunnel syndrome. And now, because of that study, they're able to add plantar fasciitis to that list of osteoarthritic issues. Okay, so why do we need to know all this? What's the big deal? The reason I even got interested in cupping is when I had some of my patients coming in with the cupping bruises, and they'd seen in the Olympics, oh, well, Michael Phelps did it, so, it's good for him, it's got to be good for me. And with that, I figured out, I better do some research and challenge myself. Cupping therapy can be considered an advanced therapy option because it helps remove toxins from the body while relieving tense and tight muscles and joint pain. It's non-invasive and a great option for your patients that has been seen to yield positive results concerning pain management and relaxation. The negative pressure that is experienced during the cupping methods helps soften muscles and lift connective tissues. It aids in increasing the blood flow to the treated areas and drain excess fluids and toxins. So with that, and it's also not that costly. I am at a community college where funds are very limited, and waiting for grants to be approved just for getting new modalities is a long wait. Cupping, like the set that I'm going to show you, I believe was only $35, which is another reason why a lot of athletes and patients are going, to Amazon or wherever and making these purchases, because it's something that isn't as costly, and if it's something that works, why not try it? And in a few seconds, I'm going to go switch to lab time, where you'll see me perform different cupping techniques on not patients, but my athletic training students. With that, I want to talk specifically about the proper application and removal of cups, the different techniques that can be used for the trunk, upper extremity, and lower extremity, and then discuss a little bit about the common patient and clinician errors and ways that clinicians can recognize and correct those errors, and then being able to review and clean the materials or the cups, because it's something that you are able to reuse, but we want to make sure that we're abiding by the health and safety standards, and we're sanitary with the equipment that we use. If after this video you have questions, I want to make sure that you know you're more than welcome to contact me at derollo@mjc.edu. That's DEROLLOJ@mjc.edu. And from all of the different studies and statements that I've made in here, here are a few of my references and a few more. And I will be more than happy to share this PowerPoint or this video with you if it's something that you choose that you want. Alrighty, and now it's time for our lab situations to be able to go over different cupping. Like I've stated before, we are not going to utilize any of the wet cupping by any means. I just wanted you guys to know and be conscientious that that is something that is being used and actually is very widely researched. Most of the research articles that I found were on wet cupping, so that was another limitation in the case studies that we reviewed. For our actual cupping, I have this cupping set that we'll go ahead and utilize, and it's a really good idea to make sure that you have good lotion. If you happen to have lotion that happens to be runny or whatnot, it's more likely for if you're doing movement cupping, for it not to be as pliable and can potentially actually even cause your patient some pain. If it happens to be on a hairier part of the body, if you don't have enough lotion on, it can actually start pulling and tearing the hairs, which also will cause your patient discomfort. We have a whole bunch of cocoa butter here, which is something that we will utilize. And in the cupping set has several different types and shapes of cups. It ranges from something very, very large-ish to medium, at that diameter, to a much smaller cup in diameter. And depending on what body part and what your main focus is going to be what determines on what size cup that you utilize. If you're working on the back or a body part that has a large surface area, it's a good idea to use one of the bigger ones. Later on in this lab session, when we go over plantar fasciitis, I'm going to use a smaller one. The reason being, it's a smaller surface area, it has more curves, and more than likely when you actually are on the bottom of the foot doing movement on the plantar fascia, quite frequently you lose suction. Just because if somebody has really, really high arches, or if you just happen to lose surface space on that body part, you're very, very much more likely to end up not having that suction or losing suction. Okay, so with that, I also wanted to show you there are some cupping sets that are electronic, which you will be able to, obviously they're much more costly, but you would also be able to differentiate exactly how much air pressure that you're sucking out. One of the good things about these is that you can see through them and you're able to see the skin going up, look for discoloration or any type of adhesions, and then also make sure that you're checking with your patient and their comfort level on whether or not it's too much or not enough. Another thing that you can do with the cups is they have several of these where it'll help with pressure points. So there's the opening where you're going to stick on the inside of this, and when you place it on the patient and add this and you would pull up the suction, the skin actually is going to end up coming up, and this acts as a pressure point. You would not use this for movement cupping. It would actually cause them a whole lot of pain, probably a lot more bruising than what you normally see. So be cognizant of that. All right, now let's get to our patients. All right, we are going to start with moving cupping, and one of my athletic training students has graciously allowed me to utilize his tricep for this. So one, we want to make sure that they're in a relaxed position. If we can have their arm hanging over the treatment table, completely fine. So we're going to go ahead and expose the area. And one of the things, anytime you're doing any type of cupping treatment, you want to make sure that you're palpating the area that we're actually going to be cupping. I'm actually doing this with one of our baseball athletes who's about 4.5 weeks post tricep strain, and he's got some adhesions going on in one particular spot. So he is getting great results and really liking the results and having a lot more motion. So this is something that I have found that actually already works. One of the things that I've already talked about before with the moving cupping is making sure that you have enough lotion. First and foremost, I'm picking the middle cup. If I were to use the large cup, it probably could suffice and get the whole entire area, but I have a feeling if I were to move just slightly the wrong way or whatnot, it's going to end up losing suction on that. So one, I'll go ahead and put lotion around the outside of the cup, and then while we're palpating the area, go ahead and make sure that you're lubricating the area with lotion as well. Okay. So with this, we'll place it in one spot, and the good thing about this is you're able to visually see. Also ask your patient for feedback as far as if it feels like it's pinching them too much or if it's really uncomfortable. So usually with this, about 1.5 to 2 pumps. Okay, we'll let it sit there for a second. How are you feeling? He's got to say that, right? So with that, I'm also going to make his skin taut and actually move up and down in line with the muscle. Maybe you should not have your face. Shelley. Okay. And I mean, I don't know if you can tell by his grimace that it's not the most pleasant feeling, and he has a healthy tricep. But we're increasing that blood flow. And if you can tell, it's a lot more pliable and movable as when we first started. Just going up and down, probably a good minute or so. And depending on where the adhesions are, you can go ahead and move around in that area. Okay, and then to alleviate, you're going to just go ahead and lift up on the cup to move. And like I had said before, we don't just want to leave it as is. I still like to move and rub out a little bit. That will help kind of circulate and disperse whatever toxins may have come up. And then also, while I'm doing this, I'm able to see kind of the results. It's one thing to have them tell me what's going on, but when I palpate prior to the treatment and then afterwards, I can actually be able to inspect and see where if there are still any adhesions or if it got better, worse, or potentially stayed the same. Okay, and we talked a little bit about having the cupping bruises or cupping hickeys. That's not always the case. I want to go ahead and show you with just this one treatment. There's a little bit of redness, not a ton, and maybe one little spot that might potentially have a little bit of bruising effect. But again, it's very interdependent on, one, the amount of pumps or suction that you have, the duration of movement, and then also any type of residual edema or anything that may be in there from a prior injury. Okay, now when working on the torso, depends on what you actually want to have as far as an effect. Lately I've seen several athletes with either low back pain or upper back pain, and word of mouth has gotten around, oh, cupping fixes everything. Not really, but when your athletes tend to start talking and then they get interested in it, it's something that frequently they want to see what's going on with that. So with one of our athletes in particular, they have several knots in their back. So with that, not this patient, but with that, we're going to go ahead and use a little bit of acupressure, and instead of, there's little spots on here that will show that you can pull up almost on any website, and use the knowledge base with acupressure and cupping. So with that, I would recommend go ahead and getting, however many cups that you're going to use prepared with that. And with the back, it's such a large area that we're going to go ahead and use the larger cups. And again, putting the lotion around each of them so you're able to create suction, adequate suction, and be able to hold suction. So with this, again, like with anything, you want to make sure that you're palpating the area so you're able to actually get the exact spot. So one, be mindful of modesty. Some athletes are more modest than others. If it happens to be a female, maybe she's only wearing a sports bra, perhaps you can take her into a different room, or if we have a table here that's on the other side of the wall that maybe we would be able to utilize for that particular treatment. But again, I have lotion on my hands and I'm palpating the actual area, finding the knots, or looking specifically at the pressure points on my back. And my hands are cold, so I feel really bad. Okay. I'm just now being afraid. Okay, and this treatment we're only going to do for about 2 minutes. I'm going down here. You okay? Mm-hmm. Okay. So like I said, we're only going to do this for 2 minutes. A lot of times people could, something that clinicians might happen is, they start getting busy with another patient or whatnot. And with that, then you run the risk of giving them the treatment too long. This happens to be his first treatment. Really, I would only do 2 to 3 cups. If this is something that continuously happens, then I might add up to more cups. I'm going to move this so you have a better view. You can see where the pressure points are on each of these. Okay, so with that, I'm going to go ahead and remove them in the same order that you place them on. You can already see some of the marks. So I'm going to go ahead and rub the area out. And with this, he's going to have those traditional bruises or hickey marks from the actual cupping that got everybody interested when they saw Michael Phelps with those. A lot of times you can actually do this and work on movement patterns to kind of break up any type of adhesions or to kind of increase potentially the range of motion. Okay, and now we're going to do one for the lower extremity and doing it with motion like I had spoke about before. So say she has a calf injury and we're trying to work on getting some range of motion, we can go ahead and use cupping as a tool. So make sure that we have adequate lotion both on the cup and on the area that we're going to cup. While we're applying the lotion, again, making sure we're palpating and figuring out where some tender spots can be, or if there's any adhesions that we're going to work on. Got 2. How's that feel? You okay? Okay. First, not the most pleasant feeling to start off with. Moving it. And now that it's gotten a lot easier, we're going to have her go ahead and plantar flex and dorsiflex while we're moving it. So as I'm moving up, you're going to dorsiflex. Put up. Okay. Got that one little bump right there. Sorry. And now I'm just going to go ahead and apply her into forceful dorsiflexion while we're holding the cup in that same spot. Go ahead and just move it up and down, dorsiflex, plantar flex a couple of times. I'm going to go ahead and release this and then also rub it out. Ideally, with something like that for the range of motion, you want to use a goniometer and measure dorsiflexion before and after to see how much motion that you've been able to gain. Okay, and just like we talked about with the case study about cupping being effective for plantar fasciitis, it's something that you can utilize as a tool for any of your patients that do have that. So same, very, very similar. With plantar fasciitis, we want to make sure we're using a small cup, regardless of if somebody is flat-footed or has high arches, because when you're moving it along the plantar fascia, you're going to be able to maybe displace the face of the cup, and you're going to be more likely for it to potentially come off, as I'm sure you'll see. So again, sure she didn't know she was going to get a foot massage today. Okay, so just placing it on the plantar aspect and pulling. Now that my hands have lotion all over them, they don't want to hold. How you doing? You doing okay? Ready or not? Okay. Moving up and down. Oh good or oh bad?
No.
Okay. Also because she doesn't have plantar fasciitis. And she doesn't really have any adhesions. Okay? Yep, I lost it. So we're just going to go ahead and regain suction on that again. For that one. That one's going to get a little bit of adhesion. Release, pulling that and lifting it up. Okay, so as you can see with the cup, there's lotion all around it. We want to make sure that we're not, we're cleaning in between the actual cupping and using a new cup for each new patient. And that's something I'll go over in 1 second. Okay, so there are a couple of things to think about when you're cleaning the cups. First and foremost, you want to make sure that you're never using one cup and then immediately using it on another patient, as that can cause some kind of skin issues. The other thing is, it's easier if you immediately clean right after you use it as opposed to waiting a while. So similar to if you leave dishes in the sink and once you get back to it, it takes forever. You can still clean it, but it just takes forever. Same thing with cupping. You want to make sure that you clean it right after you use it. Another issue that happens, and I found one of my students put the cups away before they cleaned it, so now the little area that the cups go on has the lotion all around it, and then it ends up getting sticky and gross everywhere. Okay, so when you clean the cups, the first thing you want to be able to do is wipe off all the excess lotion with either a towel, paper towel, whatever the case may be. Once you get that excess lotion off, you can either use bleach, or I like to use rubbing alcohol just because it's readily accessible. I don't care too much if I accidentally spill it on my black shirt. And when we're cleaning, we don't want to clean just around the edges because the skin was sucked up in there and lotion got all the way around. So we want to make sure we get inside the cup, but not too far up inside. It would be ideal if we could just throw it in a dishwasher and, it'd be good to go. But that's not the case. If we were to put it in a dishwasher, or if we get liquid or anything too high up in the cup, we get that liquid stuck. Now, some cups you're able to pull this off, other cups not always, but if you do have liquid that ends up in there, like one of the other cups that we no longer use, it runs the risk of creating bacteria that can reside in there and settle. So make sure you're cleaning inside, but you don't want to go too high up. And again, we're cleaning all the way around. Also, for the pressure points, we want to make sure that we're cleaning because this also touches skin. And with this, we're not too worried as far as not having anywhere for the liquid to hide. Okay, once you're done cleaning that, you can go ahead and put them away. I would recommend cleaning right after as opposed to waiting. You run less risk of accidentally picking up the wrong one and using it on somebody, and it's just easier if you do it right away. So, with our lab time, we were able to talk about the proper application and removal of the cups. Remember, we're placing the cup directly on the skin surface, engaging the suction unit, and watching visually to see how much skin comes up, looking for the desired effect. Also getting feedback from your patient. The first time you might not be able to have a ton of feedback, but after they've started getting several different cupping treatments, they already know what to feel like, and maybe they might be more likely or wanting more pressure, so you're able to have more suction on that. We reviewed different techniques for an upper extremity. We used the tricep in our instance. we used somebody's back for the torso, and then for lower extremity, so we already went over techniques for the trunk, and we utilized the lower extremity, both doing the calf with movement, and then also doing a specific treatment for plantar fasciitis, like one of the review articles that we went over earlier. Some of the common patient or clinician errors are basically not knowing what they're doing or not having a particular goal with what they're doing. You don't want to cup just to cup. Just like some of my students or athletes would come in with the cupping bruises, but they didn't have a rhyme or reason, or they weren't really working on a particular area that they needed to. And I wanted just to say, as far as for a conclusion and wrap up, that cupping is a great tool. It's a tool to have in your toolbox. It's a something that you can use, and it's very low cost, and doesn't require a ton of time, and you get huge amount of benefits. As far as I've seen benefits with the couple of patients that I've worked with this, and I would definitely recommend that you play around with a faux patient and until you're comfortable with actually applying it to one of your current patients for a desired outcome. But again, as clinicians, that's how we are able to learn and apply. So that's what I have for cupping. If you guys have any questions, comments, concerns, feel free to shoot me an email or call me. We can chat and go over anything. I'm still relatively new to cupping. It was something that like I said before, it was something that I was interested in because my patients were coming in doing self-treatments and were having these gnarly bruises. You don't necessarily have to have those cupping bruises for an effective treatment. It can and does occur, but not always. I wanted to reiterate that I would never use the wet cupping or any type of blood and opening ourselves into that whole entire realm. There's a potential that maybe you might be able to, depending on what your state law practices are. It's just not something that I am comfortable with doing. Just like with the fire cupping, I've actually had it done on me just out of curiosity, but again, not something that I want to have in my clinic in open myself up for exposure or lawsuits or just accidents to happen. Heaven forbid somebody were to accidentally get burned or whatever the case may be. This is just a lot safer method in my thinking, or in my opinion. Like I said, if you guys have any questions, please feel free to reach out to me, and I'm looking forward to next semester. Have a good one.